everyone, it's Dr. Carmen here, and the other day on my Instagram and Facebook Live, I was getting a lot of questions about masks. Now, we all know that cloth-based masks have become a normal part of our daily lives, and there are some important things that you need to keep in mind when you are wearing your face mask to ensure that you're not only protecting yourself but also those around you. So I thought I'd just make this video just to talk a little bit more about the different types of masks and what their purposes are, and then also go into a little bit of the things that you need to kind of keep in mind when you are wearing a mask in order to keep yourself and those around you safe. So I've got a few face masks here. If you want to learn more about how to wear them appropriately, then please do stay tuned. So the first mask that I want to talk about is this one, and this is the surgical mask. And as the name suggests, it is used in operating theaters while surgical procedures are taking place. Now, the purpose of this mask is to keep the bugs from the person who is wearing the mask from coming out of the person's mouth and nose and landing in or on a surgical wound, perhaps of somebody on an operating theater. So if you were to imagine that you went into theater and you were having an operation on your abdomen. Let's say, for example, they needed to cut your abdomen open and expose the inside of your abdomen to be able to see what's going on inside there. You wouldn't want the bugs that are coming out of my mouth or my nose landing inside that surgical wound, because as we all know, there are many millions and trillions of bacteria and bugs in our mouths, and so the purpose of this mask is to keep those bugs from landing into the surgical wound of a person who's having an operation. That's primarily what the surgical mask is used for. So as the name suggests, and as I've just explained, this mask is only to be worn by medical professionals. Now, I see a lot of people walking around with these types of masks on. I think perhaps what's happened is that people went out to go and buy in bulk, and I also think that since the pandemic, lots of companies are making these masks, but really these masks are not advisable for the general public to use. Part of the reason for that is because people will not wear them correctly. Remember that this is medical personal protective equipment, and so you need to be trained on how to wear these appropriately. For example, I find that a lot of people are reusing this mask, and it's really not designed for multiple use. The other thing to take into consideration is when this mask gets wet, the barrier is actually breached and the mask is not effective anymore, and so it really should be changed as soon as it gets moist. The other thing to remember about a surgical mask is a surgical mask is not going to prevent you from getting coronavirus infection. So COVID-19 infection or any other infection that's airborne is not going to, you're not going to be protected against that if you wear a surgical mask. And so I think that when people wear these masks, they get a false sense of security because they think that once the mask is on, that they are now safe and that they are now not going to be exposed to the infection, which is very far from the truth. The other thing about these masks is that they are supposed to be disposed of correctly. So because they are medical masks, they're supposed to be disposed of in medical waste. And so when you throw one of these masks outside, for example, there's a chance that somebody may see it, may pick it up, may wear it for themselves, and in that way the infection can spread very easily from person to person. So just remember that this is a surgical mask. It is meant and designed for medical practitioners and medical personnel, people who are trained on how to use PPE correctly. This mask, remember, is not going to prevent you from getting an infection. It's designed to protect the patient from getting an infection from the healthcare worker. I'm going to come back to this mask just now when I show you a demonstration about why it's so important to wear the masks correctly, but that's a surgical mask. The next mask that I have is an N95 mask. Now this one kind of looks like a duck bill when you wear it, and the reason why this mask is called an N95 respirator is because it will filter out approximately 95% of particles that are bigger than 0.3 nanometers in size. So this mask is specifically designed with a filtration system in it Unlike the surgical mask, which does not have an appropriate filtration system, this mask does have a filtration system, and this mask is designed to protect the person who's wearing it from getting an infection. Remember, the surgical mask, we said, is preventing other people from getting infected by the medical practitioner. The N95 mask protects the practitioner from getting infected by a patient or a person who is positive. In this case specifically, we're speaking about people who are positive for COVID-19 infection. So the N95 mask, again, this is a medical grade mask. The other thing that is unique about the N95 mask is that it has a hydrophobic layer on the outside. Hydro means water, phobic means against or repellent or something that you want to avoid, right? So for example, if water droplets were to land on the surface of this mask is designed not to absorb those water droplets. So the other thing that's unique about the N95 mask is that it can be reused in a rotational way. So what I mean by that is, as a healthcare practitioner, if you have several of these masks, you can wear one on day 1, another on day 2, another on day 3, etc. And then by the time you get to day 5 or day 6, you can come back to the first mask and then continue the cycle on. And that's a big difference between the N95 mask and the surgical mask. Remember, this mask is a single-use mask, and in fact, as we mentioned earlier, if it gets moist, then it should be discarded immediately. The N95 mask, provided it is not soiled on the outside, can be used on a few occasions by healthcare practitioners. Only meant for healthcare providers, and they really should not be used by the general public at all. Now moving on to our third type of mask, which is what everybody in the general public is recommended to use in most countries around the world. This recommendation has come under the approval of the Centers for Disease Control, and this is the cloth face covering. Now, the cloth face covering, typically we recommend that they should be at least 3 layers thick, and that the outer fabric should be a very dense or very tight knit, and preferably it should be made of a very good, sturdy, thick type of material. So these are the type of masks that the general public is recommended to be using. And in a similar way to how the surgical mask does not protect the person wearing it, in a similar way, the cloth face covering will not prevent you from getting COVID-19 infection. The purpose of the cloth face covering is to ensure that people who are infected with COVID-19 do not then spread things like their droplets, for example, and put other people at risk for getting the infection. Remember that there are a portion of people who will be positive for COVID-19 but don't know that they're positive. And so in that case, it becomes especially difficult to be able to control who's infected and who's not. And so the cloth face covering, the principle or the idea behind it is that if everybody wears a cloth face covering, then the amount of particles and droplets that are entering into the environment carrying COVID-19 infection is going to be reduced. That is why it is important for everybody to be wearing a cloth face covering. Now you can go out and buy one. I know that a lot of people are making these masks today. Just ensure that the person that you're buying them from has made them appropriately, meaning that they need to be able to cover your nose and cover your chin as well. There shouldn't be any gaping on the sides, and the mask should be at least 3 layers thick. So the other benefit of this mask is that it can be reused. So this is the only mask that can be washed and reused. It's recommended that every person have at least 2 cloth face coverings at their disposal, so that when you're washing one, you're able to wear another one. So remember, as soon as you take this mask off, it should be washed immediately. So there are also some safety considerations around masks just to keep in mind. Firstly, children under the age of 2 should not be wearing face masks, and neither should people who are unable to move or protect themselves, because the mask can pose or can be a strangulation or choking hazard. So if a mask is wrapped very tightly, for example, around the neck and the throat area, and the person wearing it is unable to loosen it, this can cause problems. And so just make sure that you are ensuring that the person who is wearing the mask is actually able to ensure that it doesn't become a strangulation or choking hazard. So let's get into a little bit more about how we should be wearing these masks. I'm going to use this mask to demonstrate, but remember that this mask is only supposed to be used by medical personnel. It's just a little bit less clunky and a little bit easier to demonstrate, and a little bit easier for you to be able to visualize if I use this mask. But just remember, if we're members of the general public, we should be wearing cloth face masks. So important is that the face mask covers your nose and covers over your chin. The other thing that's important is that there's no gaping on the sides of the mask. Please do not also remove the mask from your face when you are talking to somebody, for example. Avoid touching and adjusting the mask throughout the time that you're wearing it. Remove the mask by its straps and avoid touching the front of the mask when you are removing it from your face. I've used glitter just to illustrate viral particles on the front of the mask, just for you to get a clearer picture as to what it is like when you are wearing a mask and if you keep touching it and adjusting it and putting it under your chin, for example. So for the next few clips, I'd like for you to imagine that the glitter that you're seeing are droplets with viral particles in them, just to be able to illustrate to you how important it is for you not to keep touching your mask. It's also vitally important not to leave the masks on surfaces. So commonly people will remove the masks and then leave them on tabletops, for example. Just imagine that those glitter particles that you're seeing on the table are potential viral particles. And so just remember, whenever you touch a contaminated surface, whether that be your mask or even a surface that has viral particles on it, every time you touch your eyes, your nose, your mouth, you are putting yourself at risk for COVID-19 infection. And so it's important that while we remember to wear our masks and our cloth face coverings, that it is also important to ensure that we are washing our hands with soap and water for at least 20 seconds.